Hey, welcome to Case of the Day, and we're back. Today is Monday, and we have the 17th case, which means we're on week 5, and I've still managed to do this. And today we're going to look at a case I reported this afternoon. What does cartilage look like on MR? And so this is a 31-year-old operated for a pubic chondrosarcoma 3 years ago, now has recurrence. There are two components to this lesion. Now, the one here that you see in the proximal thigh has a classic lobulated T2 bright appearance. This is cartilage in any focal bone lesion. And if we can remember this appearance, I think it just becomes very easy to get that. Now, when we look at focal bone lesions, this should be the MR scanning protocol, and we must avoid FATSAT images, because those PD FATSAT and T2 FATSAT are done when we're looking for internal derangements, but they don't really work very well when we're looking at focal bone lesions. And I've got these two lectures back to back that I gave at Nanavati MRI 2 weeks ago, and they're there in this playlist, the bone and soft tissue neoplasms playlist. Now, the superior component, and you can see the sagittal that shows the superior and the inferior component. The superior component shows a lot of T2 central bright areas, and you could call this necrosis or cystic, but that's not what it is. In the setting of a cartilage tumor, this means myxoid change, and we shouldn't use the word necrosis or cystic, but knowing that it's always myxoid, that's the term that we should be using. Now, the dynamic contrast study here shows peripheral nodular enhancement with central filling in, which simulates a liver hemangioma. So that's a good analogy to keep in mind. Anything that looks like a liver hemangioma on a dynamic contrast CT in a focal bone lesion is cartilage. So very quickly, what does cartilage look like? You get these rings and arcs appearance and a cloudy matrix on X-ray. On MR, we get this lobulated T2 bright septate appearance and this nodular peripheral enhancement with central puddling in. You can see the rings and arcs on the X-ray. You can see the lobulated septate in this phalangeal enchondroma. And in this chondrosarcoma in the femur, you see the rings and arcs. This is an osteochondroma with secondary chondrosarcomatous change and the T2 lobulated septate appearance beautifully seen on this axial study. I actually did a lecture on central cartilage tumors, focusing more on how to differentiate ACT from chondrosarcoma, etc. ACT being atypical cartilaginous tumor. And again, I think it's there in the playlist if you search for it. The slightly delayed contrast study shows the two different components. Here's the central filling in. There is obviously a central mineralized component as well. You can see the rings and arcs on the CT and just these cloudy appearances in the superior component, the peripheral nodular enhancement in the superior component and the septae, and then this filling in that occurs in the inferior component. So to summarize, in patients with focal bone lesions, knowing the X-ray, CT and MR appearance of cartilage, especially the MR appearance, because so often when we're reporting MRs, we may not have access to the X-rays and the CT. So T2 bright, septate, lobulated, nodular peripheral enhancement with gradual filling in on the dynamic contrast study, and that appearance of puddling with peripheral nodular enhancement, basically anything that looks like a liver hemangioma but is in the bone is cartilage. And then, of course, we can decide whether it's benign, aggressive, atypical cartilaginous tumor, etc. That's a different thing that I'll cover another time. That's the WhatsApp channel. Thank you so much for tuning in. Take care.